The BARD SureStep Foley tray system is designed to help you efficiently insert Foley catheters while maintaining sterile technique to keep your patients free from catheter-associated urinary tract infections, or CAUTIs for short. To achieve this, the SureStep system provides supplies in the order they should be used and has the steps to correctly use those supplies numbered and printed on the tray for you to easily visualize and follow. You should always follow every step laid out in this kit. This video will demonstrate the proper use of the SureStep Foley tray system from BARD as we follow these step-by-step instructions. At St. Mary Mercy Hospital, the SureStep tray can be found in the pod rooms of the nursing units. To insert a Foley, you will need the SureStep kit and a pair of clean gloves. All other necessary supplies are contained within the kit. However, you could also bring a spare pair of sterile gloves, and, if a urine sample is needed, bring a Vacutainer urine sample kit and tubes. Everything that is in the kit should be used with every insertion. The only exception to this rule is the contained urine specimen cup, which our lab cannot accept, so the Vacutainer specimen cup and tubes must be used if a urine sample is required. Before you open the kit, wash your hands and don the clean gloves. Flip the kit over, and on the paper seal, you will notice 2 arrows. Put one finger under either of these arrows and pull up on the paper. It should easily release from the plastic bag. Remove the Foley tray from the bag with the label facing up. After removing the cover label, the first item you will see is a Ziploc bag that says, "Stop. Cleanse the periurethral area first." This is the first thing you should do before opening the kit any further. It is a step often skipped by practitioners because they know they will be disinfecting the peri area prior to insertion. But cleaning should never be skipped. It is important to clean the peri area prior to disinfecting. In the Ziploc are directions to clean the area and the supplies that are needed, a Purell pack, and 3 Castile soap wipes. Perform the Pericare step at this point. There are 3 wipes in the Castile packet. All 3 wipes will be used. For a male, start at the meatus of the penis, and with a Castile wipe, wipe in a circular pattern, working away from the meatus. Use a second wipe for the shaft, and a third for the scrotum. For a female, always wipe from the patient's front towards the anus. Spread the labia, and with the first wipe, wipe the far labia, front to back, with 1 stroke. Then discard the wipe. With the second wipe, clean the near labia in the same manner, and the third wipe cleans between the labia. Each wipe is used only for 1 swipe before being discarded. Remove your gloves and use the included Purell pack to clean your hands. With the label facing up, hold it between your thumb and middle finger. Use your pointer finger to push in the center of the pack and squeeze the 2 edges together. The Purell will release from the underside. Squirt it into your palm. Before you open the kit further, you will see patient education. You should explain the process to the patient fully before continuing. You can also give them this written information to aid them as well. There are also directions for use, and these can be used to guide you in your insertion if necessary. The orange sheet of sticker labels will be used after the Foley is successfully inserted, so set them aside for now. We'll come back to them. The kit is held closed by a paper tape with instructions printed on it. First, it says to orient the kit with the arrows pointing towards the insertion site. Place it between the patient's legs pointing toward the site. You should position yourself on the side of the bed that puts your non-dominant hand nearest the patient. This will make insertion easier. Then follow step 1. Open the wrap. Step 2 is to don the sterile gloves. They are located on top of the rest of the supplies. Both of your hands are now sterile. Be careful not to touch anything outside the sterile field. If at any point a hand becomes contaminated, that hand can no longer handle the sterile supplies for this kit. Step 3 is to place the underpad, which is the next item in the kit. There is a shiny side and a matte side to this pad. Shiny side should always be facing down. Slide it under the patient until it is under the insertion site, but be careful not to touch the bed or the patient with your gloved hands. If you do, you are no longer sterile, and you will need to don new sterile gloves. If you have to leave the room to get these gloves, you will need to start the process over with a new Foley kit. Because if you ever turn your back on or leave your sterile field, you have to assume that it has been contaminated while you weren't looking, and those supplies can no longer be used. But if you brought a second pair of sterile gloves, you can don them and continue with your insertion. Step 4 is to place the fenestrated drape. This step is commonly skipped because people don't think it's necessary to use both the underpad and the drape, but you must use both. By placing this drape with the insertion site visible in the opening, you now have created a large sterile field to complete your insertion. The sterile underpad overlaps the sterile field created by your kit's wrapping, and the sterile drape overlaps the sterile underpad. There is now a runway of sterility from the Foley tray all the way up to and above the insertion site. Step 5 is to follow the instructions in the tray. So we'll look to the tray for our next step. Written on the tray itself is our next step 1. Open the iodine. Remove the iodine fluid pack to reveal step 2. Pour the iodine here, with here being over 3 swab sticks. Open the packet and pour it over the swabs. Step 3 is on the next side of the tray. It says to attach the water syringe, so remove the sterile water syringe from the tray and attach it to the balloon port of the Foley. It is the port near the red tape and the Y junction of the tubing. It has a colored ring around the port. The ring gives information about the size of the Foley that is in place and the amount of water it takes to fill the balloon. The Foley catheters stocked in the pod rooms all require 10 cc's of sterile water to fully inflate the balloon. No more, no less. However, other specialty Foleys may require different amounts of sterile water. Do not inflate the balloon at this time. It is not necessary to test balloons, and it can actually weaken the material when it is inflated multiple times, so BARD recommends only inflating the balloon once, when it is placed in the bladder. Step 4 can be found beneath where the water syringe was located. It says to dispense the lube. The lubricant syringe is located right next to this step, and you can either deposit the lube in the tray and lay the tip of the Foley in it, or you can remove the plunger from the syringe and insert the tip of the Foley into the back of the syringe and place that in the tray. This method may do a better job of maintaining your Foley tip in the sterile field. Beneath the lubricant syringe are steps 5, 6, and 7. With your non-dominant hand, for a male, hold the penis as you disinfect with the iodine swabs using your dominant hand. Again, start at the urethral meatus and swab in a circular pattern, moving down and away from the tip. Use all 3 swabs as you continue in a circular pattern toward the base of the penis. For female anatomy, use your non-dominant hand to spread the labia. Use the first swab to wipe the far labia, one swipe from the front toward the back. Use a new swab to wipe the labia nearest you, one swipe from front to back. And use the third wipe to wipe between the labia, one swipe front to back. For both male and female anatomy, during these steps your non-dominant hand is used to position the genitals, and by doing so, that hand is no longer sterile. Moving forward, only your dominant hand should touch any of the sterile supplies. Remove the Foley from the lubricant with your dominant, sterile hand. Position the genitals with your non-dominant hand. For a male, insert the Foley catheter into the urethral meatus and smoothly continue feeding it through the urethra. When the Foley reaches the bladder, you will likely see urine start to fill the catheter tubing, but don't stop advancing the Foley. Advance the catheter until you reach the Y junction in the tubing. At this point, you can be certain that the balloon is resting in the bladder and is nowhere near the urethra. You can safely inflate the balloon with all 10 cc's of sterile water. Pull back on the catheter lightly until you feel resistance. The catheter is now positioned with the balloon against the urethral opening. The reason you continue to advance the catheter is that you do not want to risk inflating the balloon while it is in the urethra. This would cause significant damage to the patient. By advancing the catheter to the Y junction, you can be certain the balloon has passed out of the urethra. For a female, spread the labia with your non-dominant hand and insert the catheter into the urethra with your dominant hand. Again, you will see urine fill the tube once the tip of the catheter reaches the bladder, but continue to advance the catheter until the Y junction reaches the patient. Then inflate the balloon. Pull back on the catheter gently until you feel resistance. At this point, you may need to collect a urine specimen for lab testing. You can collect that urine from the needleless port of the tubing. You can now remove the Foley bag from the tray. Beneath the bag, you will see the final set of directions. These are for care and maintenance. Step 1 is to secure the Foley with stat lock. You'll find the stat lock attached to the drainage bag. The stat lock attaches the catheter to the patient's leg to protect it from being pulled out accidentally. Date and initial the stat lock. They should be replaced every 7 days. The stat lock holds the catheter at the bifurcation. The clamp rotates to accommodate changes in position. The stat lock should be placed on the thigh. The goal is to make sure the catheter is not being pulled or tugged with movement, so there has to be some slack in the tubing. But too much slack could cause twists or kinks in the tubing that would block flow and potentially cause retention or infection. Position the stat lock to allow just enough slack for freedom of movement. Clean the site with an alcohol prep pad. Then prep the site with a provided skin prep pad. Be sure to apply the prep to a larger area than the stat lock will cover. This ensures full coverage of the site. Remove one wing from the back of the stat lock. Place the stat lock in the desired position and make sure the wing adheres to the skin. Close the catheter into the clamp. Stabilize the stat lock by holding the clamp firmly and remove the second wing. Step 2 is to position the bag below the bladder and secure the tubing to the sheets with the clip. The Foley bag should be hung below the level of the patient.
It can be attached to the bed in the openings of the frame below the mattress, otherwise used for restraints, or at the foot of the bed. It cannot be hung from the bracket on the bed frame. With the bed in low position, the bag will touch the floor and substantially increase the risk of CAUTI. It cannot be hung in the hinge of the bed because when the bed position is moved, it could cause damage to the bed or the Foley bag. The green clip attached to the tubing is a sheet clip used to control and maintain the layout of the tubing. Use this sheet clip to manipulate the tubing so that there are no dependent loops present.
Step 3 is to document the insertion date. This should be done in Epic, but also on the provided orange labels that we set aside when we opened the kit. Retrieve those labels now.
Fill in information on the appropriate stickers on the orange sheet. If you're inserting a Foley on an inpatient unit, use the 3 stickers indicated. The long sticker should be placed on the front of the bag. If it is a metered bag, place it on the side of the meter. The other stickers can be placed on the back of the Foley bag.
Step 4 is to maintain the red seal per hospital policy. The red seal is the tape that connects the Foley to the drainage tubing. At St. Mary Mercy, this should never need to be removed under any normal circumstances. If the tape is removed, it allows the Foley to be detached from the tubing, and this allows a direct path to the bladder for bacteria. It is a substantial CAUTI risk. Step 5 is to assess the need for the catheter routinely. Foley catheters should only be used as long as they are necessary. Nurses should always be evaluating the continued use of a Foley for a patient, and when appropriate, removing them. The risk of developing a CAUTI increases with each day a Foley remains in place. Use these labels as a reference to tell you how long ago and why the Foley was placed, so that you can more efficiently evaluate if it is still needed. Place the long sticker on the meter, and the small square sticker and the reason for placement label on the bag itself. The BARD SureStep Foley tray system is a useful tool to help safely insert Foley catheters in our patients. By utilizing the supplies and directions provided, we can significantly reduce the risk of developing infection. And that can save a life.